So more and more providers are seeking opportunities to partner directly with commercial payers in their market, or at the very least to begin to put in place that underpinning of the clinical integration with their physicians. Some of the clients that we're working with are already making that big step into the future and saying, we know that we need to be more accountable for the population health in our market, even as we're still wrestling with when do we flip that switch, or when do we make that change and have the financial incentives make it worth our while. And in many cases, they're just saying, because that's the future, we believe that we need to make the investment now in being ready to take care of populations across the whole continuum, and they're putting in place the analytics, the health information exchange internally to do a better job of really understanding what drives healthcare costs, what drives healthcare quality, and how do they begin to also look at changing population health behavior and achieving wellness. What's been interesting to me is the role that the CIO has been playing in that. And they're sort of raising their hand as a business partner saying, well, we're now amassing a great amount of data by investing in electronic medical records across all sites of care. And as one hospital chief executive officer said to me, better to have a leap of confidence than a leap of faith. So all of these decisions need to be based on an underpinning of really strong data and analytics in order to be sure that that direction is where you really want to go. And now what we need to be able to do is to bring that all up from a health information exchange perspective internally, so an HIE that crosses the enterprise, and put on top of it analytics that start really addressing the business questions that need to be answered in order to respond to health reform. So business questions around, are we prepared to manage healthcare risk? Are we prepared to look at episodes of care? Do we know which physicians, in fact, are going to perform well?